I'm going to be performing a head and neck exam. So I'm going to grab my supplies, my otoscope, and provide privacy for my patient, wash my hands, and I'm going to just observe the appearance of my patient. So she appears to be in good hygiene, her posture is good, her clothes are appropriate for the season, she appears clean. I don't see any deformities, and her skin color is consistent throughout. She appears to be in a good mood. She doesn't have hearing difficulties. Her speech is clear, and I don't see any nutritional deficiencies. So we're going to start with her head. So I'm just going to be observing for eye contact and assess her level of consciousness, so she's awake and alert. And then I'm going to ask her what her name is. Okay, and do you know where you're at today?
In the kitchen.
Okay, and what's the month?
February.
Okay, and then we're just here to practice our assessment. So now I'm going to be looking at your head, and I'm just looking at the shape and contour, and I'm going to be palpating. And when I palpate, I'm feeling for any lumps, bumps, or depressions. I'm going to be feeling back here at her normal occiput. And then back up here, I'm going to be feeling for her temporal artery. And then your TMJ. Can you open and close your mouth for me? Okay. And then I'm going to be looking at her face is symmetrical. I don't see any lesions or scars. And I'm going to be assessing for her sinuses, so her maxillary sinuses. So I'm going to be pushing pressure, but she shouldn't feel any pain. Does that hurt? Does that hurt? Okay. And then, so that is it for her head. I'm going to be moving on to her eyes. So I am going to assess her eyebrows and eyelashes, and then look at her sclera. So her sclera is nice and white, and her conjunctiva is nice and pink. And I'm going to be using my otoscope to look obliquely into her eye for any discoloration or foreign bodies. So just look straight ahead. Okay. And then while I have my pen light out, I'm going to assess for perla. So I'm going to be looking in one pupil of her eye, and when I do that, it should constrict. Shine it out, shine it back in, look in the opposite pupil, and that one should constrict as well. Do that to the same side. Okay, so pupils are equal, round, and reactive to light. And if I had a different scope, I would be able to test her red reflex. I would just assess her left eye, and I would put the scope on my left eye and go in closer and closer, and I'd be able to see in. And I do the same size with my right eye, assessing her right eye. And then I'm going to be testing the 6 cardinal gazes. So I'm just going to have you follow my finger, but don't move your head. So just follow my finger with your eyes. Okay, so out, up, down, back to midline, center, out, up, down, back to midline, and center. So I also, if I had a Snellen chart, I would have her stand away from it, have her cover one of her eyes, and then point out to a line that I would have her read back to me. And I also need to test her peripheral vision. So I'm going to be putting my hands behind your head, and then you're going to tell me now when you see my fingers, okay?
Now. Now. Now.
Okay, good. So now we're going to be moving on on to the ears, and I'm just going to inspect the external of your ears. So your ears, the shape of your ears, and also looking for any drainage or lesions. And then I'm going to be looking in her ear. So this is a child, so I'm going to be pulling down. And then at her tympanic membrane, it should be a nice white pearly color. Okay, and now I'm going to be doing a voice or whisper test. So I'm going to cover her ear and I'm going to whisper a word and have her repeat it. Okay, so she repeated both of those words. So now we can move on to the mouth and throat. So with my otoscope, I'm going to use my light and I'm going to be checking the mucosa of her mouth. Can you open up for me? So the mucosa of her mouth, her teeth, her gums, her tongue, and then lift up your tongue for me. Check the floor of her mouth, her palate, and then open up and stick out your tongue for me. And check her uvula, tonsils, and can you say ah?
Ah.
So checking her gag reflex. So all of her oral mucosa was intact, nice and pink. I didn't see any lesions. And now we're going to be moving on to the neck. So I'm going to have you sit up straight and just inspect your neck for symmetry, any masses, jugular vein distension, and look at your trachea. Your trachea should be midline. So I'm going to be palpating your lymph nodes. I'm going to start in front of your ear and go in a circular motion. And then behind your ear. And up here. And this one under your jaw. And down your neck. Behind your neck. You put your head down for me. Under your occiput. And then above your clavicle. And under your clavicle. So I'm also going to check your carotid pulse. And your trachea, like I said, is midline. I'm going to be feeling it. Moving it side to side. And then I'm going to check your thyroid. So come behind you. Okay. Okay, and then the muscle strength and the range of movement of your neck. And that is all normal. So that is it for my head and neck assessment. Thank you.